Hi, it's been almost 2 to 3 years. I'm coming on video live to speak with you after 2 to 3 years. And, I just wanted to know, let you know like it's been more than few years that I've not met. I've not uploaded anything on video. Just a second, let me correct these items. Yeah. So I'm happy to share with you that I'll be coming back on YouTube with regular content and to forward my commitment to impact the quality of health education and find a way to strengthen the healthcare system. And um, so today I want to begin short with a short video. So I will be sharing something that may support medical students in diagnosing patients well. And I'm going to be, giving tips and techniques periodically to so that the medical students can go to work and diagnose patients well, right? So let me begin with the most important fundamental challenge that many of the students are facing, um, especially when students are for the first time, going to patients, talking to them, interviewing them, and they're presenting their cases or presentations to the staff who are going to evaluate, give feedback on it. I've seen many students struggle, and I see the fundamental thing that is affecting their performance is the lack of clarity on what they're up to when they're doing all this stuff. So they go to patients, see them, talk to them, write down pages of history, what's the positive history, what's the negative history, and then make some diagnosis and go. And when they present and get the feedback. But what has been affecting the quality of the presentation is the lack of attention on what students are up to as they're interacting. So here is a small tip for medical students to impact their history taking. So when you go to patients, when you are asking their name, age, address, sex, occupation, religion, so when you're beginning at that level, I want you to consider the only sole agenda you have is to diagnose patients. So here is the pitfall. What's happening is students, get this data, get the chief complaints, get the history of presenting illness, personal history, family history, past history, everything. And at the end of it, they try to see what could be the diagnosis. And that approach, that way of approaching a presentation, that way of approaching a patient interview is not very effective. So what is the recommended way? What I recommend and what I see it works is when you go to a patient, ask the name. Like if the name is Deepak, you may have to start thinking what was the diagnosis of the patient named Deepak who I spoke last. Now this may sound little strange, but I want you to consider that you have to play making diagnosis at that level. When you ask the patient age, the patient says the age, you're making the diagnosis. Address, you're looking at the endemic diseases. Occupation, you're thinking of the occupational hazards. And so that when you come to chief complaints, you don't have to, um, start the game there. Most students actually don't even start the game there. Mostly they are collecting all the data, and at the end of it, they're trying to make some diagnosis. So I hope this small tip will help you, keep your attention on making the diagnosis. Why you're talking to patients, why you're looking at them, why you are seeing them, why you are asking the questions you are asking, why you are, cracking jokes in between. Anything that you're doing with the patient is to diagnose them, because ultimately you want to treat them. And as a student or as a practicing doctor, without the right diagnosis, you can't treat them. Okay, so with this small tip, I will close this video today, and we'll meet again soon. Bye.